This video will show you how to properly set up and administer your TPN infusion. Please follow all instructions shown in this video. Administering TPN can be safe and easy with proper instruction. Your home health nurse will be available to instruct you on the procedure following discharge and will visit weekly and as needed for your catheter, dressing change, and any labs that your doctor has ordered. Remove your TPN from the refrigerator 2 to 3 hours before administering. Place the TPN bag on a clean, dry surface to warm to room temperature. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water or a disinfectant wipe. And drying thoroughly as well. Place your TPN placemat on the clean, dry area and thoroughly clean your TPN placemat with soap and water or a disinfectant wipe and drying thoroughly. Wash your hands thoroughly for at least 20 seconds and then dry your hands. Use a separate towel to turn the faucet off. Check the label on the TPN bag for the correct patient name, expiration date, drug, and frequency. Inspect the bag of TPN for any leaks or particulate matter. If you find any abnormalities in your TPN bag or label, contact Chartwell at 1-800-755-4704 to speak with a pharmacist. Gather your TPN supplies. This includes your TPN bag, CAD prism pump, charging cord and power pack, 9-volt battery, coin, 3-liter backpack, IV tubing administration set, antiseptic wipes, sharps container, 1 saline syringe, additive medications as directed on your prescription, syringe with needle for additive medications, and filtered needle if your additive comes in a glass ampule. Prepare a pre-filled syringe of sodium chloride, also known as normal saline, by holding the syringe upright. Remove the cap of the syringe. Gently pull back on the plunger, then gently push forward on the plunger to expel any air that is in the syringe. Do not touch the tip of the sterile syringe. Recap the syringe. Most TPN bags are single-chamber bags, but if your TPN comes in a dual-chamber bag, you will have 2 additional steps. Inspect the lower chamber of TPN for cloudiness or particulate matter, and both chambers for particulate matter. If you find any abnormalities in your TPN bag, contact Chartwell at 1-800-755-4704 to speak with a pharmacist. Then you will need to remove the flexible strip separating the bag into 2 chambers. Lay the bag flat on the table and pull the flexible strip upward. Discard the strip in your household trash. Flip the bag over and remove the green rod. Discard the rod in your household trash. Gently squeeze the lower chamber and rock the container to mix the 2 chambers together. If your physician prescribed additives for your TPN, it will be listed on your TPN label. Please read the medication vial label to verify that the medication and dose are correct for your prescribed therapy. Remove the protective cap from the first vial of medicine to be added to your TPN bag. If the additive is a multivitamin, it will come in 2 vials. Wipe the top of the vial or vials vigorously for 30 seconds with an alcohol wipe and allow to dry. Open the package containing the syringe with needle. Pull back the plunger of the syringe to draw air into the syringe. The air in the syringe should be the same amount as the medication to be withdrawn from the vial. Then carefully remove the needle cap from the syringe. Be careful to not touch the needle. Insert the needle into the center of the vial's rubber stopper. Inject the air from the syringe into the medication vial. Gently pull back on the plunger to allow the medication to fill the syringe. Withdraw the prescribed amount of medication into the syringe as directed on your Chartwell prescription label. Remove the needle from the medication vial. Expel all the air out of the syringe by pushing down on the plunger. Make sure the amount of medication in the syringe matches the prescription label amount. If the additive medication is a multivitamin, you will need to draw 2 vials into the same syringe. Repeat process with additional vials. Thoroughly cleanse the injection port of your TPN bag using an alcohol wipe for 30 seconds. Allow to dry for 60 seconds. Carefully insert the needle into the center of the injection port. Push the plunger all the way down in a slow and steady pace to instill all medication into the TPN bag. Syringe and needle should be disposed of in your sharps container. There is no need to recap this needle. Repeat for any additional additives. Once all additives have been added to the TPN bag, gently rock the TPN bag several times to mix the solution. As you rock the bag, inspect the bag of TPN for any leaks or particulate matter. If you find any abnormalities in your TPN bag, contact Chartwell at 1-800-755-4704 to speak with a pharmacist. The color of the TPN will change. It should look like this. If additive is colorless, the TPN color will not change. Remove trash and clean up area as you go. Remove your CAD prism tubing from its packaging. Remove the blue flow stop device from the tubing cassette by pulling it upward. Remove cover from the tubing spike and remove the protective tab from the entry port of the bag. Then insert the spike into the entry port using a pushing, twisting motion. Be careful to not touch the spike. Remove the battery door by pushing the white button and sliding the door off. Insert the 9-volt battery into the pump. Replace the battery door. You know you have inserted it correctly when the pump chirps. Open the rubber cover of the power jack on the side of the pump. Line up the red mark on the power pack's cord connector and the red mark on the pump. Then push the connector fully into the pump with a straight motion until it stops. Do not twist or turn the connector. The cord must be pushed in straight so wires inside the cord aren't bent. Once the power pack cord is connected, grasp the connector directly behind the flared portion and lightly pull to ensure the connector is securely attached. This is important because failure to push the connector all the way into the pump may result in loss of power. Watch for the message Power Pack Good on your pump's display. If your display does not read Power Pack Good, double-check the connections to prevent pump failure. Once the battery has been placed into the pump, it will go through an automatic review displaying the pre-programmed pump infusion settings. Do not attach cassette until screen reads Power Up Successful and you hear a series of beeps. Attach the tubing cassette to the pump by first securing the 2 plastic feet of the cassette around the 2 silver bars and then pushing the cassette against the pump using a hinge-like motion. It is helpful to place the pump upside down on a flat, sturdy surface to secure the cassette in place. While holding the cassette in place, use a coin to push in and turn the cassette lock counterclockwise. This locks the cassette in place. You'll hear a beep when the cassette is securely locked. The notch must be vertically positioned. If it's not fully engaged, the pump will alarm. Once the cassette is attached to the pump display will read Admin Set Latched. Press the next button to advance the pump display. Then the display will read Reset Reservoir Volume. To reset the reservoir volume, press the Y button for yes. Resetting the reservoir volume will change the amount of volume to be infused to the pre-programmed prescribed amount of TPN. The pump display will then read Prime Tubing. Priming will push fluid through the tubing so there is no air left in the tubing. During priming, the tubing filter is to be held upside down to prevent air bubbles in your tubing. Press and hold the Y for yes. Hold the Y button down until the tubing is fully primed. Do not remove the protective cap on the end of the tubing, but watch for fluid to fill the cap. Pump display will read Continue Priming. Press and hold the Y button to prime more fluid into the tubing. If priming is complete, press N. After a minute, the pump screen will go blank, going into power save mode. This is normal. Scrub the injection cap of your IV catheter with an antiseptic wipe vigorously for 30 seconds. And let air dry for 60 seconds. Flush your IV catheter with the prepared sodium chloride. Push and twist the saline flush syringe onto your IV injection cap. Flush using the push-pause method as instructed by your home nurse. Scrub the injection cap of your IV catheter with an antiseptic wipe vigorously for 30 seconds. And let air dry for 60 seconds. Remove the protective cap from the end of the IV tubing. Then, attach the CAD Prism IV tubing to the end of the injection cap, the push and twist motion. Be careful to not touch the tip of the tubing. Your pump screen will be blank in the power save mode. Push the next button to activate the screen. Start the pump by pressing the Start/Stop button. The pump will read, "Start the pump." Press Y for yes. The pump will go through an automatic review. Once this is complete, the pump will start to run as programmed. A green light at the top of the pump will blink, which indicates the pump is running. The display will read, "Running." Shortly after the pump displays running, the pump will go into power save mode. The pump display will go blank, but the green light over the display will continue to blink. The blinking green light is the indication that the pump is running. Remove all trash from the area. Now that your TPN is infusing, you will place the bag of TPN, the pump, power pack, and tubing in the large backpack provided by Chartwell. Your TPN backpack has a specific compartment on the right side to hold your bag of TPN. Open the Velcro straps of fabric and place your TPN bag in the right side of the backpack. Thread the securement belt through the hole of the TPN bag. Next, secure your TPN bag with the Velcro straps shown starting with number 1, then 2, then 3, then 4. Next, the tubing and spike will be secured by the Velcro strap under the TPN bag. Be sure the tubing is not kinked at the bottom of the bag. The CAD Prism pump and the CAD Prism power pack will be stored on the left side compartments of the TPN backpack. Slide your CAD Prism pump and power pack into the pockets and secure with a Velcro strap as shown. The pump should be placed in the clear compartment to view the pump display throughout the infusion. Tubing from the pump to the patient will be threaded through the backpack and secured with the gray Velcro straps. The tubing will come out the opening on the side of the backpack. The backpack can then be zipped closed and carried as you move around your home or community. Keep your backpack near you at all times while it is infusing. When your infusion is almost complete, your pump will beep once, and both the green and the amber light will flash to alert you that the infusion is nearly done. You will know it is time to stop your TPN infusion when the pump beeps several times in a row. The pump will automatically begin infusing at the KVO rate until the stop button is pressed. KVO rate is a very slow rate of infusion to give you time to disconnect your TPN without the bag becoming empty. There will be a small amount of fluid left in your TPN bag. This is overfill. You will begin stopping your TPN by preparing your work surface. Clean the area thoroughly with soap and water or a disinfectant wipe, and drying thoroughly as well. Wash your hands thoroughly for at least 30 seconds and dry as well. Use a separate towel to turn the faucet off. Place your TPN placemat on the clean, dry area and thoroughly clean your TPN placemat with soap and water or a disinfectant wipe and drying thoroughly. Gather antiseptic wipes, saline syringe and heparin syringe for flushing, and any other supplies as directed. Prepare pre-filled syringe of sodium chloride, also known as normal saline, and heparin syringe by holding the syringe with the tip in an upright position. Remove syringe cap. Gently pull back on the plunger, then push forward gently on the plunger to expel any air that is in the syringe. Do not touch the tip of sterile syringe. Repeat with each syringe. Recap the syringe. Press the Stop-Start button on the CAD Prism pump. The pump will ask you if you want to stop the pump. You will press the Y button for yes. Use a coin to unlock the tubing and administration set from the pump using a clockwise motion. Discard the tubing and the TPN bag into your household garbage. Press the button on the battery door and slide the battery door forward. Remove the used battery. Set the battery aside and replace the battery door. Replace your 9-volt battery 3 times a week, Monday, Wednesday, and Friday, to prevent power failure. Remove the power pack from the pump. Disconnect tubing. Scrub the hub with an antiseptic wipe vigorously for 30 seconds. And let air dry for 60 seconds. Attach the pre-filled syringe of sodium chloride to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with the prescribed amount of sodium chloride as directed by your nurse using a push-pause method. Disconnect the syringe. Scrub the hub of your injection cap again with a new antiseptic wipe for 30 seconds. And allow to air dry for 60 seconds. Attach the pre-filled heparin syringe to your injection cap and flush the IV catheter using the push-pause method. Disconnect the heparin syringe. You will need to charge your power pack once it is disconnected from your infusion pump. Insert the AC adapter connector into the power pack input port by lining up the red mark on the power AC adapter and the red mark on the power pack input port. Then, push the connector fully into the power pack in a straight motion until it stops. Do not twist or turn the connector. The cord must be pushed in straight so you do not bend the wires inside the cord. Then plug the AC adapter into the wall outlet. Your power pack should charge a minimum of 7 hours each day. The solid amber light on the power pack will indicate the battery is charging. Once fully charged, the solid green light will indicate the power pack is ready to be used. The battery should be used, charged, and stored in the temperature range of 50 degrees Fahrenheit to 95 degrees Fahrenheit to prevent loss of power. Your power pack will require monthly maintenance, once a month or more frequently. If your power pack is showing signs of not holding a charge, you'll need to use the battery refresh cycle to restore battery capacity. You will know your power pack is not holding a charge when you have more frequent low battery alarms on your pump. The power pack should not be attached to the pump when you refresh your power pack. Attach the AC adapter into the power pack input port by lining up the red mark on the power AC adapter and the red mark on the power pack input port. Then, push the connector fully into the power pack in a straight motion until it stops. Do not twist or turn the connector. The cord must be pushed in straight so you do not bend the wires inside the cord. Plug the AC adapter into the wall outlet. The AC adapter must be plugged into the wall outlet throughout the entire refresh cycle. Once the power pack is connected to the AC adapter and plugged into the wall, press the refresh button on the front of the power pack. This will drain all of the power out of the battery. The refresh cycle will take approximately 8 hours to completely discharge and recharge the power pack. The amber light will flash when the power pack is discharging and will turn solid amber once the power pack begins to charge. The green light will come on when the power pack is fully charged. TPN supplies are single-use only and should be disposed of after one use. Proper administration of your TPN at home is important for your safety. Please call 1-800-755-4704 if you have any questions or concerns at all while administering the medication. We are available 24 hours a day, 7 days a week. In the event of an emergency, always call 911.